Hey, welcome back. And I wanted to just talk a little bit today about how I view opioids for the use of chronic pain. And so I do have a number of patients, probably usually about 25 patients at any one time in my practice, who I see for chronic pain and I prescribe traditional full agonist opioids for. And these, of course, patients are carefully selected, and they agree to come in for urine drug screens and for pill counts every 6 months. And we have a contract, and typically do not have a history of chemical dependency and have well documented cause for pain, and et cetera, et cetera. But generally speaking, chronic use of opioids is not a good idea for chronic pain. And so I generally have significant concerns about continuing to prescribe opioids for many of these patients. But based on their improvement in function and their control of their medication, those sorts of things, I continue to prescribe the medication, knowing that it can be trouble. And so because of the rearranging of the opioid receptors on the nerve cell, which occurs during continuous opioid exposure, we know that people who have daily exposure to opioids will become more sensitized to pain and will experience pain more intensely. And this is called allodynia and hyperesthesia. So allodynia is when a person has a experience of pain when they do something that normally would not be painful, such as getting a hug or touching, just normal stuff they experience as painful. And hyperesthesia is when things that are normally associated with pain, like a pinprick or a hot plate or those sorts of things, are rated higher on the scale after opioid exposure. And both in animal models and in human models, we've noted that this change occurs in humans when they're exposed to chronic opioids, where they become more sensitive to pain. And this actually is real similar to what people experience with fibromyalgia. They have allodynia and they have hyperesthesia. This is a central pain disorder where people don't really have anything wrong with their body, but they experience quite a bit of discomfort and pain. And so people who have chronic exposure to opioids will have a development of something very similar to fibromyalgia over time, and will start having pain all over the place, and also their pain will get worse, which is why I say to all of my patients that taking chronic daily opioids is kind of like a deal with the devil. That initially it seems like a great thing. Opioids work for the short term and initially very well for chronic pain, but over time the pain typically gets worse and the pain begins to spread, and now you've got pain all over the place, and now the devil's got you. Just like the traditional deal with the devil. At first it sounds like a real good deal, but at the end of the deal, the devil owns your soul. And so, I kind of think of my patients who have prescribed chronic daily opioids to as kind of pre-Suboxone patients that eventually either they'll get to the point where they've lost enough weight, or they've changed, they've gotten a surgery, or we've used other things, other medications to manage their pain, that we can gradually taper them off of opioids or switch them over to Suboxone and get them off completely. But I kind of consider most of these people to really have a poor prognosis long term of continued opioids. Then generally, if we continue to do that, their pain more likely than not will get worse, or their disability will increase, or those sorts of things. So that's kind of my sense of it. And I do like to use buprenorphine for chronic pain if an opioid is necessary, because it has a lower rate of tolerance and dependence and those sorts of things. So anyway, I just wanted to share my view of chronic opioids for chronic pain. Thanks.